Can we do something? Yes, there are studies showing that some of the probiotics may be effective for the prevention of nosocomial diarrhea, and data are summarized here. But today we are only discussing Lactobacillus reuteri, and this is a study which was carried out in our department. It was a randomized, double-blind, placebo-controlled trial, and in this study, quite to our surprise, in hospitalized children, we found that Lactobacillus reuteri had no effect on the overall incidence of nosocomial diarrhea, including rotavirus infection. I have to say that for me, it came as a surprise. And the reason is why it's effective in the treatment of acute diarrhea, and it was ineffective in the prevention of nosocomial diarrhea. Usually, if we have that efficacy in the treatment, we also see the efficacy in the prevention. So, of course, we were thinking what is the reason, and we think that one of the reasons may be the differences in the dosage. So, for example, in the treatment trial, the dosage was higher than in the prevention trial. And it's so surprising for me that it didn't work that we are now conducting a new study with the same Lactobacillus reuteri, but with a higher dose. We hope to finalize this study, the inclusion, until June. It goes quite slowly, by the way, and the reason is that almost all children in Poland, when they have acute gastroenteritis, when they have any illness, any illness, they usually start to receive some probiotics. So this is and the problem. And the novelty in the study which we carried, which are now carrying out in our department, is that we stratified children on the vaccination status against rotavirus. So we will know how it works in vaccinated children and in not vaccinated children. We have to wait for the result. I will be surprised if it doesn't work, but of course we need to see what it is with in the randomized double-blind placebo-controlled trial. So what I wanted to show you very briefly is to discuss what I showed you, how it is with the use of Lactobacillus reuteri for the treatment and for the prevention of some of the diarrheal diseases. And as you can see, Lactobacillus reuteri, DSM 17938, is one of the probiotics which now can be considered in the management of acute gastroenteritis, not in the prevention. You will see in another prevention in the community in a moment, but this is our study. What I would like to discuss now, and again I would like to show you some of our results, it will be on the use on the treatment of one of the functional disorders. Flavia will talk later on about other conditions, but for the management of infantile colic. So infantile colic affects up to 20% of infants under 3 months. The crying typically starts in the first weeks of life and ends by the age of 4 to 5 months. And 1 in 6 families will consult a health professional. And of course, one of the questions is, can probiotics, could something as simple as a probiotic drink stop a colic baby from crying so much? And it's not only that physicians are interested in this question, but also the journal. This comes from the Newsweek, already was published like 3 years ago. So I will try to, in my presentation, to answer this question. But let's start with the etiology, with risk factors. The simple answer is we don't know. But what is, the cause is unclear, and despite its name, infant colic may not have an abdominal cause. So what are the proposed etiology and risk factors? They are presented here. Some people consider it's an extreme of the spectrum of normal crying. Some people consider it's a manifestation of underlying physiological or psychosocial factors. Some people consider it might be manifestation of gastroesophageal reflux or food allergy. And last but not least, perhaps the alteration of gut microbiota. And there is a number of studies showing that an aberrant gut microbiota, in fact, there is in colicky infants, and in infants with colic compared to control, there is increased number of Clostridia difficile, increase of E. coli species, and reduced number of Lactobacillus species, and certain Lactobacillus strains to predominate in infants with colic, and certain Bifidobacterium and Lactobacillus species seems to be protective against crying. It remains uncertain whether the microbiota differences are the cause or the result of the colic condition. And in this respect, I would like to call your attention to the paper which was published a year ago in Pediatrics. The aim of this study was to provide a comprehensive analysis of the fecal microbiota in infants with colic as compared to control infants during the first 100 days of life. For the method, there was microbial DNA of more than 200 samples from 12 infants with colic and 12 age-match control infants, which was extracted and hybridized to a phylogenetic microarray. And here are some of the results. You will see the higher intestinal microbiota of infants with and without colic, and you will see a higher diversity in the control group on the left side and reduced diversity in the colic group. And the differences between colic and control microbiota in the first were observed in the first months of life before the colic peak takes place, and at the age of 3 to 4 months, when the colic usually disappears, there were no significant difference. What else has been shown in this study is that if you compare intestinal microbiota of infants with and without colic, that in control infants there was much higher stability. The lines you can see on the upper part of the slide are more closer to each other than in colicky infants, which there was a lower stability. There were also some differences in the abundance of bacteria in control and colicky infants, and the author's suggestions were that the results offer opportunities for early diagnostic as well as for developing specific therapy. But anyway, this is one of the newest studies showing that there is really the link, and shows that it's probably the primary event that plays a role in the development of colic. But the question here is, can we do something with these colicky infants? These are some interventions which are being used for treating colics in infants. Many of them, only those which are marked green, are considered to be probably effective, and perhaps the best documented is hypoallergenic or extensively hydrolyzed wheat or casein-based formula, and we can make this trial in those infants. But the question for us here, is there any evidence for the probiotics used in infantile colic? And there are some studies. The first study was from Francesco Savino from Italy with Lactobacillus reuteri, ATCC, so this mother strain. It was an open randomized control trial, which is a weakness, of course. Always an open trial is a weakness, which compared these probiotics with Simeticon and showed good effect. But because of these safety issues, and because it was open trial, and because it was compared with Simeticon, there was a lot of criticism, and there was a new study published again by Francesco Savino, but with a new daughter strain. And it was double-blind, placebo-controlled trial. They included children with colic according to the modified Wessel's criteria, crying for 3 or more hours per day for more than 3 days per week. And all infants were breastfed, and mothers were following cow's milk-free diet. And this is a study. What you can see, there was reduction Lactobacillus reuteri, reduced the crying time, and increased the number of responders. Responders were defined as 50% reduction in crying time from baseline. And it's based on these studies that American Academy of Pediatrics in 2010 concluded there may be benefit for treating infantile colic with probiotics, but further studies are necessary. And if the American Academy of Pediatrics says further studies are necessary, so in our department we start to work. And this is what we have done. This is a study, randomized, double-blind, placebo-controlled trial, which was published already a year ago, and we looked at the effect of Lactobacillus reuteri, DSM 17938. And the aim was to determine whether the administration of these probiotics is beneficial in breastfed infants with infantile colic. And we perform, as I said, randomized double-blind trial with intention to treat analysis. In principle, we repeated the study of Francesco Savino. We included 80 children, full-term infants, aged 5 months or more, less than 5 months, with infantile colic according to modified Vessel's criteria, which were exclusively predominantly breastfed. And they were randomly assigned to receive either Lactobacillus reuteri or placebo once daily for 21 days, and the follow-up was for another additional week. And the primary outcome was a treatment success and duration of crying. And as you can see on this slide, the treatment success, reduction on the daily average crying time of more than 50% was increased, and it was not only during the intervention, but also after 1 week after the intervention. And the number needed to treat was 2 to 3, so 2 to 3 infants would need to be treated with Lactobacillus reuteri in order to have this treatment success in 1. We also show there was reduction in the duration of crying throughout the study and this 1 week follow-up, and also reduced parental perception of colic severity and increased family quality of life. So we concluded exclusively or predominantly breastfed infants with infantile colic benefit from the administration of Lactobacillus reuteri, DSM 17938, compared with placebo. How this intervention might work, we don't really know. Flavia is one of those who works on this mechanism. I can summarize it by saying that there are some studies showing the effect of Lactobacillus reuteri on gut motility, colonic sensory nerves, colonic contractile activity, pain perception. There are additional mechanisms which include anti-inflammatory effects, which were documented both in vitro and in vivo, and interaction with altered gut microbiota. But precisely, we don't know. Going back to the question which the Journal of the Newsweek asked, could something as simple as a probiotic drink stop a colicky baby from crying so much? I would say there is evidence from 2 independent randomized control trials, 3 altogether, but 2 with the same strains, that exclusively or predominantly breastfed infants with infantile colic benefit from the administration of Lactobacillus reuteri DSM 17938 compared with placebo. There is also meta-analysis published very recently which looked at the Lactobacillus reuteri for the management of crying, and as you can see there was reduction. I have some questions when it comes to this meta-analysis because they pulled together the data on these 2 probiotic strains, and as you see I do prefer to evaluate all of them together separately, but still if you pull them together then you see there is an effect. What is new, and you will hear in a moment, I'm not going, Flavia, don't worry, I'm not going, but this is a very nice study that you will hear in a moment, not only in the management of colic, but also for the prevention of colic, not only for colic, but also of regurgitation, and we are lucky that Flavia will be able to present it by herself. So in summary, I discuss only 2 indications, which are diarrheal diseases and infantile colic. You may ask yourself, Lactobacillus reuteri, DSM 17938 in pediatrics, to use or not to use it? And I really like this English acronym, STEPS, which takes together all these items that we should take into consideration when we are making any decision about anything. Safety, and probiotics are generally safe. Tolerability, probiotics, including Lactobacillus reuteri, are well tolerated. Effectiveness, it's always important to look at the specific probiotic strain and the specific indications. And I showed you well documented for management of acute gastroenteritis and for the management of infantile colic in breastfed or predominantly breastfed infant. Price, this is something which is always very individual, and simplicity, and probiotics, including Lactobacillus reuteri, are very simple to use. And let me finish with a final comment, and the final comment from the discussion between Einstein and his student. One student to Einstein, the questions of this year's exams are the same as last year's. And the Einstein answered, yes, true, but this year all answers are different. The same applies to my presentation. Thank you very much for your attention.